guys. I want all of my topics to focus on COVID-19. Now, I promise that all these topics are not going to be health and science related. They're not all going to be technical, but I think it's important to talk about like some of the subtopics that center around this pandemic, because we don't think it's going to come to an end as quickly as we thought before. Content that's going to be presented today is not meant to substitute or be in lieu of medical advice. The text, graphics, links, images that are contained in this content and video is for informational purposes only, including and not limited to links and comments. Okay, now that I've gotten that out of the way, on to more important business. Read. Now, it doesn't have to be a book. I was just using that as a read an article that's focused around COVID-19 that specifically talks about real ways to prevent and to identify whether you may potentially have the disease. But maybe skip those WhatsApp chain messages, Nigerian aunties and uncles. There is so much misinformation that's been floating around. Even me, I was freaking out, if I'm gonna be honest. I felt like, oh my god, I'm gonna be trapped. I was trying to like Google and research stuff, and any video that was kind of coming my way, I'm watching it, and kind of got a little freaked out by one of them. One of my friends was like, yo, Evie, you're acting like a Nigerian auntie right now. Stop forwarding this misinformation. Once I really like settled down, calmed down, I'm like, what am I doing? Like, I need to chill. But honestly, when things are hitting the fan and there are no answers, and it just seems like nothing makes sense, I think as humans we naturally tend to look for information somewhere, even if it's not from the most reliable source. So we're looking for information from an authoritative figure or authoritative agency that can help calm us down, that can help us make sense of like the craziness that's going on. And honestly, I totally understand. So I have some links and websites that I found or were able to kind of calm me down a little bit and like keep me informed without freaking out. And I actually asked some friends of mine that work in different aspects of like healthcare. I'm just compiling everything and gonna share it with you guys. So the first website / organization or authoritative resource that I'm recommending, and you guys all know about this already, is the World Health Organization. So they have their general website, of course. They have a YouTube channel, so you can, watch videos and get a little bit more informed. They have these situation reports that are about 10 pages long, a little bit more of a deep dive. And at the end of the report, they actually give suggestions to the public. But y'all may not have known, they have WhatsApp updates. So you can actually text hi to a WhatsApp number, and they have, I think, 4 different languages. I give them props for thinking outside of the box. It's crazy because I literally manifested this. I was talking about as I was writing like my script. So round of applause. So the second resource that you guys are already probably familiar with, Centers for Disease Control and Prevention, or also known as the CDC. Now they have a YouTube channel also. They have their website, but they also have these specific pages that I would say you should check out. I'm gonna, of course, link it below. The pages talk about prevention, and then also it's like a self-check. It's a self-checker that will actually show you ways that you can test the symptoms and see if you potentially have COVID-19. Make sure y'all check that out. And now the third resource, this is actually the one that I've been checking on the daily. It's an interactive map, y'all, and it basically shows you the count per country, and also if you want to get a little deeper into like the states and regions and whatnot. And it's just a nice way to kind of look at the map to see like what areas are being the most affected. Now the last one is a little bit more technical, so for those who want to read up a little bit more and have like an understanding of how clinical trials are going, National Institutes of Health, also known as NIH, they have a list of clinical trials. So if you want to get more into like the weeds and technical aspects of how a development for a potential cure is going, you can look there. Now, of course, links to all the above or all the previously mentioned websites are going to be in the description box below. I'm going to stick to these 5 websites and kind of use it as a way to keep my peace. And please don't send me WhatsApp messages anymore about some potential COVID-19 cure, about some tea and lemon concoction, or you gotta put a little baking soda with water and Heineken. Like, stop it. Thank you. Stop it. I would really say try to stay away from it, because it's just going to freak you out. It's going to stress you out. You're thinking that you're curing or preventing something that you probably are not actually. Thanks for watching the show. Make sure you like, comment, and subscribe. See you next week. I played back the footage and I think there's a creaky, the chair I'm sitting on is a little creaky, so my apologies.